Hi, this is Dr. Mike Carberry. I'm from Advanced Medical Integration. I want to thank ChiroSecure for this opportunity today to talk about our markets in healthcare. So let's go to the slides. So I know a little bit about marketing. Before I became a chiropractor, I have a marketing degree. I graduated in 1983 from Stockton University in New Jersey. And my first job out of college, I was hired by a company called Dun& and Bradstreet, an affiliate company they owned, and I was selling advertising. So I know a little bit about markets. I think not like a social media marketer, but a markets marketer. So let me explain what that means. A lot of chiropractors say, oh, well, in my area, my patients wouldn't do this or my patients would do that. I hear that a lot. My patients wouldn't spend that much money. My patients wouldn't stick to a care plan. So let me just talk about the different markets in healthcare and how you guys might not realize you're in a very niche market, which you can actually break out of. And I'll talk about that too. So first, before I go over these things, I just got to clear this. Numbers are very big and it's easy to just assume they're all the same. They're not. If we were to start counting a million seconds right now, we wouldn't be done until 11 days. If we started counting a billion seconds right now, we wouldn't be done for 37 years. And if we were to start counting a trillion seconds right now, we would be done in 37,000 years. So these are huge numbers. Keep that in mind as we look at this. This was an article from Consumer Reports in 2016, and they were concerned that America went from 2.5 billion prescriptions in 1997 to double that, 4.4 billion prescriptions in 2016. Well, let's fast forward now to 2026, and we're at 7 billion prescriptions in this country. So the market in healthcare is dominated by one type of treatment, and that is prescriptions. What kind of a result does that get? Well, let's talk about the cost of that. The world's healthcare bill is $9 trillion. That's a lot of money. The US portion of that healthcare bill is 5.2 trillion. Now keep in mind, we are 4.2% of the world's population, and we consume over half of the world's healthcare money or bill. So what do we get for that money? Well, we don't have some great results. First of all, I want to just tell you the result of that is 2/3 of personal bankruptcies in the United States. The number one reason for personal bankruptcies in the United States is unpaid medical bills. And 3/4 of those people had insurance. This is from my book that I wrote in 2018. We've checked the numbers. They're still correct. It's still the number one reason for personal bankruptcy in the United States. So you got to realize insurance isn't saving anybody. It's just steering people into certain treatments. So this is the results of those treatments. This is an article from the Office of Economic and Cooperative Development from the United Nations, and this is in 2022. And the report was U.S. healthcare from a global perspective, accelerated spending, worsening outcomes. And they talk about how we have both per person and as a share of gross domestic product, our healthcare cost is higher than all other high income countries, in fact, and higher than all other countries, period. And the results of that, comparing us to the other high income countries, we have the lowest life expectancy at birth, the highest death rates for avoidable and treatable conditions, the highest maternal and infant mortality. Infant mortality is how well does a baby survive the first year of life? And there are third world countries where babies have a better chance of surviving than the United States, which is ridiculous. Most people don't realize how high our suicide rate is. Suicides are 48% higher in the past 20 years. Remember this, every time you hear about a homicide on the news, there was two suicides. And the largest segment of the suicide market, and this was in 2022, was age 12 to 17 years old. Interestingly, that market was being pursued by the pharmaceutical industry for antidepressants, 12 to 17-year-olds at that exact time. So go figure. Well, let's take a look at the numbers here. We have the highest chronic disease rate in the world. Who said that? Well, Robert F. Kennedy, the Director of Health and Human Services. He said our chronic disease rate is over 60%. It was 2% in 1961. We have 77% of our youth between age of 17 and 24 are currently ineligible for military service without a medical waiver, which is ridiculous. So our healthcare, even though it's really expensive, apparently is not effective. Let's look at these costs. So if you look at arthritis, chiropractors say, well, I treat arthritis. Okay. Let's look at arthritis. The CDC says it's a $140 billion annual treatment just for the medical treatment of arthritis. And this includes office visits, medications, non-steroidal anti-inflammatories, and biologics for rheumatoid arthritis, especially joint replacement surgeries. Okay, the indirect cost, the loss for work and caregiving and the burden on that is another $300 billion a year annually. Okay, so that's one source of numbers. There are other sources of numbers, and there's other categories. For example, if we look at this, we compare chronic degenerative arthritis to other chronic diseases. Arthritis, which is runs in a 140 to 300 billion dollar market, is in the same ballpark as diabetes, which is 327 billion, and cancer, which is 250 billion. Alzheimer's 360 billion, cardiovascular disease, 400 billion. So you go, all right, it's right up there. Now, there's a lot of tricks you can do with numbers because let me show you another category that is not counted in this. And that is spinal pain. Low back pain and neck pain are the number one drivers of healthcare spending when measured as a conditional category, according to JAMA in 2016, and many follow-up studies back that up. The costs are estimated to be well over $300 billion spent for the treatment of spinal pain. Now, if you overlap that with arthritis, those numbers increase. Now, there's going to be some double counting, but those numbers are going to increase incredibly. So now you look at the combined costs, and it could be $600 billion for just the treatment of arthritis and spinal back pain or spinal pain. So when you look at another authority, and this is the Institute of Health Metrics and Evaluation of the University of Washington Medical School's report, they say 60 to 70% of the money spent for pain is for musculoskeletal pain, specifically low back and neck pain being the largest, and then knee, hip, and shoulder. They all fall right into our category. So what is the number they came up with? Well, they came up with a $722 billion number. That is huge because it's a trillion for pain, and they think 60%, 60, 70% of that is 722 billion. That means the market that we treat has a greater income potential than the cancer market, the heart disease market, and the diabetes market. So you look at this and it says $530.6 billion in medical care expenditures and 192 for lost work and productivity. So you're looking at possibly a market that is between 500 and 700 billion dollars for what you treat as a chiropractor. Um, if you look at that and you say, well, let's take that as $1,500 per person spent on the treatment of pain and arthritis. If you go to a medium-sized town like Chattanooga, Tennessee, which is where I had a practice, when I first opened there, the market was 140,000 people. Well, that meant $210 million spent on what I was treating in that town. $210 million. And so you ask yourself, well, yeah, but we're not hospitals. We can't compete with hospitals. Just ask yourself this, doctor, who has a better outcome, chiropractors or hospitals when they're treating low back pain or chronic degenerative arthritis? I would be willing to argue that we have the best remedy. Why are we not getting a bigger market share? So let's look at this a couple different ways. First of all, every dollar spent in an integrated clinic that has chiropractic and physical medicine focusing on functional outcomes, not basically functioning on symptom outcomes. See, that's the difference between traditional healthcare and chiropractic. We focus on function, where traditional 97% of all drugs ever invented are for the treatment of symptoms, symptom management. So every dollar spent in one of our clinics saves thousands of dollars conservatively in the entire medical system. So this is what we treat. You know, if people have arthritis, it's not just an aging thing because you look at this X-ray right in the middle of it. There's a healthy disc. Right below it is a bulging disc, and right below that is a severely degenerated herniated disc. They're aging at different rates. Why is that? Well, they have a functional deficit, and the only ones really looking at functional correction is us. So if you look at surgery, the reason they have horrific outcomes, and I think you know these, I've heard one surgeon tell me from or she was with NYC. She said she was an orthopedic surgeon. She said 75% of back surgeries have to be repeated in less than 2 years. Well, that is a horrible outcome because the surgery only accounts for the thing that's causing the pressure on the nerve, causing the pain, not necessarily the functional thing that caused that disc to weaken in the first place. That's what we deal with. Um, if you look at this, there's a lot of studies out there that show when they compare sham surgeries to real surgeries, they have improved outcomes with the sham surgery. This one here, in particular, was for knee surgeries. They took a group of people. Some of them got the real knee surgery. Some of them just got the anesthesia, the betadine prep, the sutures, and the incisions in the skin, but they didn't know if they got the real surgery or not. 74% of those patients who got the fake surgery reported improvement. 50% of those, their improvement was equal to or better than those who actually had the real surgery. So you got to ask yourself, what's going on in healthcare? How do we stand? Here's more studies from Europe showing the same thing: sham surgeries. It quotes one in the United States, but there's many of these studies saying that you compare real surgery to fake surgery, and a lot of times the fake surgery does better, at least equal to. So all markets are not the same. Let me get to the point what we're trying to point out here. If you look at this and you go, well, my patients wouldn't do that, my patients wouldn't do that, you're probably correct. Because if you look at the market here, and I'm showing 100% of the population in the United States, 9% go to a chiropractor. Well, some people say, no, it's 12%, whatever. We could round it off at 10%. But you got the vast majority not going, but you now know the vast majority has the problems that we can help. See, there's a bigger market out there, and that are people, and that's the 40% that I'm showing on this graph, of people who are facing things like surgery or medication like opioids, and they don't want it. They don't know what to do. These people are more motivated, but they're not specifically looking for chiropractic. So if you stay in that funnel looking for that 9%, those people are innovators, and innovators typically want things newer, cutting edge, and cheaper. They are not willing to spend the same amount of money. But if you tap into that 40% market of people trying to avoid a surgery, they're not comparing your price to the chiropractor down the street. They're comparing your price to surgery. And if you looked at something where let's say you charge them $10,000 for a care plan, which is not unheard of in our model, well, that wouldn't even pay for the anesthesiologist to put you out for the surgery. So you look at it and you go, wow, these people are actually getting their life back. Medical people who get into this model working with us, who realize they're not hurting anybody anymore, they're not prescribing all these drugs just to cover up symptoms, but they're actually seeing patients get well because you're seeing the patient come in on a regular 3 time a week basis, getting physical modalities and getting better. Once you tap into this market, they start referring you people like crazy because they're not used to getting their problems corrected. They get used to their problems being managed. So I just want to point out there are different markets out there, and we are not tapping into the market that's right in front of our face. We have the best outcomes. We should be working on tapping into that market. When you become a medical clinic, you actually following the rules of chiropractic, going from least invasive to most invasive, not the other way around, not doing surgery first or an opioid first, and then if that doesn't work, then we'll try surgery and we'll give you more opioids during the surgery. You're actually going, let's try some physical medicine. Let's try some chiropractic. Let's try some rehab. Let's try some exercise, some very non-invasive things. So my intention, my drive for my company is to disrupt the industry of healthcare and to unite medical professionals so they can collaborate and correct the underlying cause of health problems and help those professionals achieve business success so that physical medicine and functional nutrition become the first choice in the quest to bring about health, not the last alternative choice. So that's why I'm here bringing this message to you. I'm very glad to do it. We start here and we end up with a better country. I want to thank, first of all, if you want more information on this is how you can reach out to us. There's our website, www.amidoctors.com, or discover at amidoctors.com, and there's a phone number there. So reach out to us. We're on YouTube. Our channel there is Advanced Medical Integration. So I want to thank ChiroSecure for giving me this opportunity to bring this information to you. Realize there's ways to tap into a bigger, more lucrative market, and America needs us now more than ever. Thank you.